Thanks for coming back for part two. There's a guy mowing lawn back here. I hope that doesn't disturb the audio. I think we'll be okay. So I came back to my parents. I think that's where we left off. The seizures were pretty prevalent at that time. The next seizure I had, I was actually on my way home. I was driving again. And I'll tell you what, a Ford Escape, no matter what year, even if it's a brand new one, is not going to win versus a brand new steel light post. Just an FYI. I totaled that vehicle. Luckily, I came out fairly unscathed. Concussion, bumps and bruises, but fairly okay. I'd had concussions in the past. I kind of knew what I was dealing with, so it wasn't that big of a deal. They wanted to try ketamine infusion with me for pain at the university. Now, they had done ketamine infusions at the university for anxiety and depression. They'd done that in multiple patients before, but they had never done it for pain. So I was the first, I was kind of the guinea pig for that and decided to try it. I did two different sessions of it. I tell you what, it was kind of a trip. Did it work? No, it did not work. As soon as I left there, I was right back where I started when I went in. With the CRPS pain, and remember the back pain, I told you that I had a back fusion. So my back was really acting up at this time as well. Now, I was still working out very regularly. I always kept myself in good shape. Despite the pain, I was working through it. So that didn't work. The next step that they wanted to try was a spinal cord stimulator, where they take this device, I suppose it's about that wide, about that thick. They insert it, you guys probably heard this before, but just going to explain for people that maybe don't know. They put it in your back, kind of on the right side of your spine, or at least that's where they put mine. I've heard sometimes they put it in your leg. That's the only other place I've heard it before. You guys may know other places that they've tried it before, maybe on you or somebody you know or you read somewhere. But they decided to put it in my spine. And I asked, how long is this procedure supposed to take? They said, well, maybe 20, 30 minutes. Now, the anesthetic that they give you, and I asked about the anesthetic, they said, well, we're going to give you ketamine, which is fine. I obviously been used to ketamine. But what they do is they give you the ketamine and then they stop it so that they can keep you conscious and then put you under, keep you conscious, keep you, so that they know when that spinal cord stimulator will actually work so that you can actually feel like the pain go away, the pain come back, the pain go away, the pain come back. Well, it took them 2.5 hours to do this procedure because of all the hardware that I had in my back. The most painful procedure that I have ever had done. So they put that in. And so it was a trial run for a week. So they gave me this little iPhone, and I can raise the stimulation or lower the stimulation depending on the amount of pain I'm in. And they start you at like I think it was like a 3, something like that. I don't know. It was like 8 years ago. And I don't know. I think I raised it up to like maybe like a 7 or 8 at one point, and that's when I could really feel. But I was also feeling the vibration in my spine, and I'm a hardware, which is affecting my back. So it did. It didn't do anything for the CRPS. It actually hurt my back more than anything. So that was an absolute no go. So I go to have him take it out. It was easy taking it out. It was just boom, pull it out. No big deal. So now we're kind of back to square one as far as what we're going to do with the CRPS. That's where I've done back at square one. on all the meds, on the more or less the gabapentin, which I'm sure you guys are on. They don't know what to do. So now I'm stuck in this great big world that it seems like more often than not you find pretty much everybody you talk to that has had some sort of depression. That's my world, and that's where I've been stuck in for, well, it started when I got the surgery, my knee surgery, which ended up with CRPS back in 2014. And then when my fiance left, that's what kind of took the depression to the next level. And that's what I'm having a hard time getting over is my fiance leaving. Yes, the CRPS is there. It's not going away. I've heard a lot of times where CRPS people, or not people, but individuals that have CRPS, they go into a state of, I can't think of the terminology, where it just kind of vanishes for a while. And then it comes back and go. Mine has just always been constant. I've never had that state where it's gone away. But my depression has always been there. So that's kind of what I want to veer this conversation to is the depression, the anxiety. And I'm trying to dig myself out of this. I have I've had a shrink for years that I absolutely adore her. She's helped me a lot, and I'm trying to get a hold of this situation where I can just let things go, and I don't know how to do that. And from the very first 2 minutes of the first video, I think you guys have figured out that I don't know how to let things go as far as how TCO, and I don't want to throw TCO under the bus anymore, how I ended up with this, and I can't let that go. Yes, it was a mistake. They didn't do it on purpose. I know that. They don't do it. Nobody does like things like this on purpose. But I can't let it go. And my fiance leaving. I don't think that she intended to hurt me on purpose. I don't think anybody does that. But I can't let it go. I've had a couple of relationships thereafter. It just wasn't there. And that's probably on me because I just cannot let things from the past, I can't let it go. And I want to. And I don't know how to do that. And I'm sure that I know there's other people that are out there that have these exact situations of they can't let things go. And if you have figured out how to do that, please reach out to me and let me know how you've done that because I would love to know. I really would. So this is part two. Kind of emotional for me. Um, as I said at the end of the first video, you never know who you're going to run into on the street. Everybody has invisible diseases. Be kind, be safe, and be good. Talk to you soon.